PCOS is not that kind. Not a lot of people know it and they don't know why. Fighting this fight to make me stronger. So one day I may have a son or daughter. I am stronger than I appear. I am fighting through all this fear that may not be clear. To keep on going, to make it known, one day at a time. Some days are harder than others. To keep myself going, to pray a little harder. I am stronger than I appear. I am fighting through all this fear that may not be clear. To keep on going, to make it known, one day at a time. Some people have not.
Hello, and thank you for watching my video. This is my video on Polycystic Ovarian Syndrome, otherwise known as PCOS. And in this video, you're going to hear my story as well as 4 other women who agreed to share their stories as well. And I've also got an interview that I was able to do with a medical assistant. So we'll hear from her. And in the beginning, you actually heard a little bit of a song that my sister and I wrote together about Polycystic Ovarian Syndrome, and she is actually the one singing it. So you will see her name in the credits as well as 2 of the women's names in the credits and the medical assistant's name in the credits. So if you would like to look them up or find any more information on them, you can. So let's get started. My name is Shiva and I'm 30 years old. I have 2 beautiful stepsons and a husband and a wonderful family, a wonderful mother and grandparents, and 2 sisters and a brother. And when I was about 20 years old, almost 21, I found out that I had Polycystic Ovarian Syndrome when my first husband and I had miscarried. And I knew there was always something wrong, but I'd been through test after test after test when I was about 15, 16, and 17, going on from 8th grade into high school. And I had unusual menstruals, unexplained weight gain, facial hair, extreme pain in my sides, and panic attacks. And the doctors couldn't explain why. At the time I didn't have any cysts on my ovaries, so they didn't know what was going on. But when I miscarried, they did an internal ultrasound and found out that I did have Polycystic Ovarian Syndrome. And it can cause fertility issues, which is one of the reasons I miscarried. It can cause weight gain, facial hair. And it really sent me in a downward spiral, and my ex-husband and I didn't talk about it. Instead, we just kind of kept our emotions in, which wasn't good for our relationship. And he felt like I let myself go, and because I did gain more weight, the facial hair became a little more prominent, and that embarrassed him. And eventually he said he fell out of love with me, so that relationship ended. And it really took a toll on me, and when I was able to move on again, the next guy I got involved with, I actually did end up getting engaged to him, and I really did fall head over heels in love with him, but he didn't want children and thought because I had the Polycystic Ovarian Syndrome, it was a possibility that I would never get pregnant, which is still a possibility. But I still want children, whether that means IVF treatments, surrogacy, adoption, foster to adopt. I want to be a mom. I'm a stepmom. It's a little different. And I love my stepsons like they're my own. But they have a mother, and I know that, and she and I get along very well. And while I love them like my own, it's different to have them call you Gina. They don't call me Mom. I want to be called mom. So I really want to be a mother. And it's something I've always wanted. I've always wanted to be a mom. So it's a big thing for me. So that relationship ended because he didn't want to be a parent. And he just decided that wasn't for him. So I had to move on. And now I'm happily married with my husband and have 2 beautiful stepsons. And he's very supportive. He's my rock. He's awesome. He's willing to do the surrogacy if we have to. He's willing to do the IVF treatments if we have to. He doesn't put me down because of my facial hair. He's just awesome. I can't explain it more than that. He's always there for me. If I need to talk about PCOS, if I need to cry about it, he listens. So that's kind of my journey from finding out that I had it to now. And this has impacted my family a little bit. My mom doesn't have it. My youngest sister doesn't have it. Only my sister, who's a year younger than me, and myself have it. And it's in our genes from my biological father's side. So my mom is great and supportive, but there's times where she does get a little at me about making sure that people can't see my facial hair. She doesn't understand that. But there are women I know, and one in this video, who can rock her facial hair. And that is very admirable to me. I can't do that personally. It stresses me out to even let it grow for a day. So I can't do it, but she can, and that is awesome, and she rocks. And I know other women who are on my PCOS groups that can do it, and it's very, like I said, very admirable, because I can't, but I am very supportive of them, and I think it's great that they do what makes them happy. I decided to do this video because, like I said in the beginning, I believe that Polycystic Ovarian Syndrome needs to have more awareness. There's so much judgment in this world, and so many people that assume that because I'm overweight, I am very unhealthy, I don't work out, I'm lazy, which is far, far, far from the truth. I am very active, constantly going, and I rarely get a chance to actually sit down and relax. And when I do sit down and relax because I deserve it. But I am constantly going. So that is ultimately why I decided to do this video. I really think that this will make an impact. For me, I've also had to learn a lot about Polycystic Ovarian Syndrome on the wellness side. I know what the symptoms are. I've lived them every day. But to know what helps with them, I'm still in the process of learning that. I've actually got a doctor's appointment scheduled for December the 3rd to go and see the gynecologist and hopefully get put on something to help me with fertility, because we are going to try for a baby. So maybe my next vlog will be, yay, I'm pregnant. Fingers crossed, you can always hope. So, there is that. I know metformin doesn't really help me that much, but the prenatal vitamins that my gynecologist did put me on about a year ago, those seem to really help regulate me, but they haven't helped with the facial hair, and I haven't gotten pregnant, so I can say it hasn't helped with that, but I do know that the prenatals have helped with regulating me. So I'm really wanting to work. I have joined a gym, and I wanted to work more on my weight. So I have gotten involved in that, and will start working out on Mondays and Wednesdays and Sundays at Planet Fitness. And I do a little dance here at home with my stepsons. Every time we have them, we have a little dance party in the living room. So that burns a lot of calories, let me tell you. And I was really bullied about my weight, my anxiety issues, and my facial hair growing up in high school. And it really, really impacted me. And that's what caused me to not want to show my face. And if I hadn't taken care of it in the last few hours, I would be very embarrassed going back and forth to the bathroom and checking. And I don't like being overweight, so I am working on that, and it was something I was very bullied to. So I would like to introduce you to the rest of the girls who have also done these videos, and from here on out we'll hear from them. And thank you. Hi Kayla, how are you today?
I'm good, how are you?
I'm good. I want to thank you for interviewing with me. How long have you been a medical assistant?
For 10 years.
10 years? That's great. Okay, and how experienced are you with women with polycystic ovarian syndrome?
Actually, I'm pretty experienced. I have it myself, plus I've seen several patients with it as well.
Okay. Would you have a good estimate about how many patients you have seen with it in the last 10 years?
I don't know exactly how many, but I have seen quite a few, probably well over 100 patients.
Wow, that's a lot. And how many different offices have you worked in? Have you worked in a hospital, in a gynecologist's office, doctor's offices, all of the above?
I've worked in OB/GYN, I've worked in pediatrics, and I've worked in family practice.
Okay. And how many women would you say are affected by polycystic ovarian syndrome?
At least 25% of the female population, I would say that I've seen.
Okay. From the facts I gather from online, it's 1 in 10. Would you say that's accurate? 1 in 10 women have it? Okay.
Yes.
Okay. When a woman comes in to the office you work at and you believe she has polycystic ovarian syndrome, what are the ways to diagnose this illness, since so many women's symptoms are different and not all women have cysts?
Well, there are several symptoms that they can have with polycystic ovarian syndrome, like obesity, infertility. They can have cysts on their ovaries. They can have hirsutism, which is male pattern hair growth, hair loss, any of the above. If they have the hirsutism and the obesity, you will automatically do blood work. If they have missed periods, you can do blood work. Or if they have any kind of a family history of it, you will always do blood work as well. The blood work that you would start with would be a TSH and a free T4 for your thyroid, an insulin level to see if you're insulin resistant, a testosterone level to see if you have an elevated testosterone level, which would put you in the hirsutism range. And then you also can do an A1C to see if you're diabetic along with the PCOS, and like a CMP and a cholesterol level.
Wow.
And there is the ultrasound that you can have done as well to check for cysts on the ovaries.
Well, thank you for that information. I knew there were a few tests because I've had to have some of those done, but I wasn't aware of all of those tests. That's really good information to have for other people who are listening to this vlog. Given that some of the most common symptoms are cysts on the ovaries, the weight gain that you spoke about, the unwanted hair growth, and the fertility issues, what would be your recommendations in treating these symptoms?
Obviously, to get diagnosed with this and to have all the blood work done, you would have had to obtain a family practice, an endocrinologist, or your OB/GYN. And I suggest that you follow their suggestions, whether your PCOS be severe or it be very mild. There are things you can treat it with, like metformin, that help control the insulin resistance. It can also help with fertility. There's medicine to take for the hirsutism, spironolactone. That medication, if you are planning on becoming pregnant, is not something that you should take. You can also take birth control to help with the cyst and also to help with regulating periods, since PCOS comes with irregular periods.
Okay, and I know that there are a lot of herbal supplements and vitamins out in the market today. What is your thought on these compared to metformin and the other medicines that you just recommended, that you said are different ones prescribed by different doctors with women with PCOS?
I, of course, always would go with whatever the doctor recommends. If you are looking at something over-the-counter, something herbal, something natural, then that's something that I would always take into your doctor, and I would ask them to read the active ingredients, see if it's something safe for you to take, with your levels, if it will help you, if you're trying to become pregnant, if it's something you shouldn't take, etc. It's always good to check with your doctor before you start taking the medication over the counter.
Okay, and what are what can possibly happen to someone if they leave their PCOS untreated?
Again, with the male pattern hair growth, you can start growing hair on your chest, on your stomach, on your back, on your face. That would become unruly without treatment. Your obesity could severely increase. If you're not treated for PCOS and you're trying to get pregnant, the possibility is 1 to none. Anything can really happen if you go without having your PCOS untreated. If you want to try diet and exercise to help with it, that's fine, but I'd still needing to be treated by a physician is what is best recommended.
Okay, well, thank you so much again for your time. I believe you covered the questions I had, but is there something that I didn't touch on that you believe that people should know about PCOS that aren't aware of it?
More people have it than you think that they do. Just looking at someone, and just because they're obese does not mean that they have PCOS. Looking at someone, and because they have diabetes does not mean they have PCOS. PCOS is very, it's non-judgmental. Anybody can have it. Skinny people, fat people, anyone can have it, and it's not just a black and white kind of disease.
Okay, but it is something that does affect women.
Yes.
Right. Okay. All right. Well, again, thank you so much for your time, Kayla. And you said that you're a medical assistant. Do you have any other? Is there a different title that I should label you as for this?
My actual title is NCMA, which is considered nationally certified medical assistant.
I was first diagnosed with PCOS, I believe, about 6 years ago. What made me want to get checked was that my husband and I couldn't get pregnant. I experienced a lot of things like hair loss, irregular periods. I had a cervical biopsy, a uterine biopsy, went to a specialist in Grand Junction, Colorado. It wasn't until I moved to a bigger city that I saw a specialist, and they finally figured out that I had polycystic ovary syndrome after the help of my mother, who pulled a magazine article and had me look at it. The magazine article asked about, do you experience a hard time losing weight? Do you have a lot of belly fat? Do you have regular periods? Do you have excessive hair growth? Which I had all. When I took that to the doctor, then I was diagnosed with PCOS. The things that bother me the most, I guess, are the not being able to have a baby. I have a real hard time with that, and because I don't have any children, and the excessive hair growth, and as you can see, my hair is falling out. I do have the facial hair that's a huge pain. I've tried everything between laser, plucking, shaving, waxing. It's a pain, but I have a very understanding husband. I guess the things that help me the most with the PCOS is the diet, which I'm now starting to try. I'm not big on a lot of the meds. I was on a lot of birth control as a teenager, and I believe that helped with my hormone problem.
Another sign for me was, if you can see, my neck has always been dark. When I was younger, my great grandma tried to scrub it off with the Brillo pad. She thought it was dirt, and I later found out that it was an insulin resistance. I've tried medications like metformin, which I was severely allergic to. I was also put on a blood pressure medication that used to make me pass out while driving. So I don't currently take any medications for PCOS. I'm going to try to control it. I wish there would have been some more information about PCOS out there, so I would have known what I was dealing with a lot sooner than I actually found out what it really was. It was always just blamed on having a hairy father. I am going to be 40 this year. I'm now experiencing male pattern baldness, hair on my face. I could probably grow a full beard, a mustache. I'm very hairy. What made me want to do this interview is I think that there needs to be a lot more awareness about PCOS so that young women realize what's going on with their bodies so they can do something to combat the symptoms. So people are nothing's worse than going somewhere and having somebody stare at the hair on your face, or a little kid ask you if you're a man, or just the stares in general, I guess, is the worst thing for me. But my husband makes me feel very beautiful and confident.
Thank you for meeting with me today, Jennifer. How are you?
Good.
Obviously, you are pregnant with PCOS. And how long did it take you to get pregnant?
About 2.5 years. Or 2 years.
Or something around there.
Yeah.
And did you have to take medication to get pregnant?
Nope.
Nope, you were able to get pregnant naturally.
Yes.
That's awesome. And if I remember correctly, did you have a doctor's appointment to set up?
Yes, I was going to the doctor in 2 weeks after I got a positive pregnancy test to talk about fertility medicine.
How hard was it for you to realize that you were pregnant with PCOS without having to have help?
I didn't realize it until I was a week late. And then I still didn't start my period, so I decided to take another test. And at first it came up negative, and then I looked back over, and it was a positive. So then I got like 5 more tests.
5 more? Just to make sure, right?
Just to make sure.
And when was it that you found out that you did have PCOS?
When I was like 15.
And how did that impact you?
I was very sad because I wanted children more than anything in my life, and I got told that I may not be able to have children. But it explained a lot of my pains and stuff.
Did you have a really good doctor?
Yes.
And they were very good about explaining what polycystic ovarian syndrome is?
Yes. Actually, the one that told me was my ultrasound tech. She's like, oh yeah, you have PCOS. I can see all the cysts on your ovaries.
And what symptoms of polycystic ovarian syndrome do you have? Because every woman with polycystic ovarian syndrome is different.
I have weight gain that's hard to lose, acne. I have chest on my stomach, and I have hair on my chest and stomach, and severe period pain.
How has this impacted your relationships? And now, obviously, he's no longer your fiance, he's now your husband, but how has this impacted him as well?
He was worried that we wouldn't be able to have children, but since I got pregnant, we're a lot more stable and able to know that we can at least have one child together. Yeah. And then if we can't have any more, we just plan to adopt.
That's awesome. Do you have any words of encouragement for women such as myself who are trying to get pregnant and having fertility issues with polycystic ovarian syndrome, given that doctors do tell us that there is a chance we may not be able to have children? Just keep trying. It's fun to try, at least.
I have been married to my wonderful husband for a little over a year now. We've been together for 2. We have 4 crazy, adorable cats. They are little gremlins and they drive me up the wall. They're my entire world and I consider them my children. Well, I was diagnosed with PCOS when I was around 13. My doctor at the time who diagnosed me, I'm assuming didn't know much about it, because he basically told me that it wasn't a big deal and not to worry about it. So that is exactly what I did. I didn't worry about it. I didn't make it a big deal. And to be honest, I kind of sort of forgot about it. I mean, I never really did, but I put it on the back burner. And I never learned about it. I never knew what that meant. So, yeah. My journey from then until now has been a roller coaster ride. My symptoms really hit when I was in high school. I had the depression, I had the facial hair, I had the anxiety, the weight issues, of course. I've dealt with my weight my whole life. I've never really been small. I was when I was really younger, but I don't remember it. I just have a few pictures. But anyway, struggled with the weight my whole life. But yeah, it was the depression, the facial hair, the anxiety, crazy sleeping issues. I've dealt with my whole life too. My mom said I couldn't sleep as a baby. But I've always had trouble sleeping. Always tired. I've never had any energy. Some days would be better than others. But that is something that's always taken a toll on me, is never having any energy. No matter how much caffeine I have. About a year ago is when I did my research for PCOS. Like I said earlier, I was diagnosed when I was 13, and I never really knew what that meant. My doctor said not to worry about it, so that's exactly what I did. I didn't, even though all this crazy stuff was happening, I was, ashamed, and I kept it hidden, and I stayed quiet, because I didn't, I felt like a freak. Something was wrong with me, and I didn't feel like a girl. I felt ashamed, so I stayed quiet, and I didn't think much of it. I didn't put the 2 and 2 together, and I didn't do that until I finally did my research, which was about a year ago. I read something online that said PCOS on it, and I was like, hey, I have PCOS. So that was when I actually looked it up online and did my research about it, and I was shocked. I was angry. I was so mad because it was a big deal. And I wish I could have known all of this, because I could have done something about it a lot sooner. But, for the past year, ever since, I did that research, I just decided to take one day at a time. I joined several support groups on Facebook. That's been a big help. Counseling, that's been a big help as well. My counselor was awesome. Just, like I said, just taking, every day, one day at a time, and just doing the best that I can, to keep going, to keep fighting. The major impact that happened on my family, my husband and I, was probably the fertility issues that we have been experiencing. That's another question you answered was, do I struggle with infertility? As I do. So I'm gonna include this one inside the how it impacted my family question that you asked. Yes, my husband and I suffer from infertility. We've been trying to conceive for about a year now. Soon after we got married, I went to my OB, and I told her, that, we were trying to have a baby, and, that it was gonna be hard. And she told me that she would not help me until I lost weight. And that completely devastated me, because losing weight is not easy. I've been trying to lose weight for a long time. Ever since high school, I've tried everything under the book, and it is so hard. So not only do I have to, not only is it hard to have a baby, but I have to lose weight too in order for someone to help me, or to be helped by a doctor when that's their job. So that, like I said, that completely devastated me. I became very depressed. I gave up on everything. I didn't want to get out of bed. The only time I really did get out of bed was for work. And for a while there, that took a toll on me, and kind of took a toll on my marriage with my husband. I don't know if he felt that way, but I did, because I was so depressed. I was suicidal. I was crying all the time. My mood swings were crazy. I was snapping at my husband for no reason, like every 5 seconds. I'd yell at him for no reason, and to be honest, I don't even know why he's still with me, but he is, and he has been my rock. I still have my days, but like I said, counseling helped me so much. And then the support groups that I'm in on Facebook, they help a lot. But mainly my husband. He's been my rock. He's been my major supporter, my number one. He's always there for me. He always knows what to say or how to make me laugh. He's my rock, and if it weren't for him, I probably wouldn't be here. Things that I've been bullied for, mainly just my weight. I've never really been bullied by anything else, because I kind of hid everything else. Of course, weight is not that hard, or it's kind of hard to hide, your weight. If I could have hid that, believe me, I would. But everything else I hid my depression, I hid my anxiety, I hid my facial hair, Everything else, it was hidden. I never told anyone because I was ashamed. But the weight was the main thing that I've been bullied for my whole life, and it sucked, but eventually I got through it. I still have my days. I'm not as bullied as much as I used to be, just because, I'm not in school anymore, and been out of work for a while, so, but yeah, if I was out and about, I probably would be bullied, but it doesn't bother me as much as it used to, because I've learned to accept who I am. My husband makes me feel beautiful, so I listen to myself, and I listen to my husband, and I try not to listen to anybody else. I know that's easier said than done, and it's taken a long time for me to accomplish that. But,
My name is Little Bear Schwartz, also known on stage as Little Bear the Bearded Lady. I am a sideshow performer, a burlesquer, an opera singer, and a writer. I'm 32, and I live in Seattle with my boyfriend and my cat. When did you find out that you had PCOS? So here's the funny thing. Despite being able to grow hair on my face since I was 14, I actually did not receive a positive diagnosis until just last year when I was 31. Because I have the symptoms but not really the cysts, I kept getting negative diagnoses. It was not until last year that I finally found a doctor who was able to confidently say that just based on the symptoms alone, I'm a clear candidate for it. So I've only known for less than a year. Can you tell me a little about your journey from when you found out until now? Well, it's hard to say because by the time I found out that I had it, I had already grown out my beard. I had kind of already figured I had it. So I was at a lot of peace with it when I found out. It was really from my teens and 20s that I really, really needed that diagnosis. So the journey technically starts long, long before I even had a diagnosis, but I struggled with it a lot due to, hair, weight, all of that, difficult periods. How has this impacted your family? I mean, the PCOS in and of itself is really not the issue. My parents don't really understand. Well, they're getting better, but for a long time they didn't really understand why I was growing out my beard, or especially they had a hard time coming to terms with me doing sideshow work. But as far as the disease itself, it's not really been an issue in my nuclear family or in my relationship. 5, what made you agree to do the interview with me? I kind of feel like I'm on a slightly different planet than a lot of other women with PCOS, so I thought maybe I would be able to present a slightly different point of view. When it comes to wellness, what has worked for you and what hasn't? I'm actually pretty new to this idea of treating PCOS. For a long time, I had a lot of pride about it and would talk about, up until very recently, we talk about how my PCOS is not something I'm ashamed of, it's something I'm proud of, it's something, it's given me a gift. So the idea of treating it, things like insulin resistance, weight, approaching it as something that needs to be treated is actually fairly new. I generally stayed away for a long time from the PCOS community because there's a lot of self-loathing, and a lot of people, I think, resented me for not feeling that way. So I've only recently started doing, PCOS dieting with the no gluten, no dairy. So that's working so far in the week and a half that I've been doing it. I've also been upping a lot of my weights, and instead of doing what is known as the cardio snore, which is when you just walk around on a treadmill or an elliptical for an hour or bike for an hour. Instead doing really, really short, high impact cardio mixed with really strenuous weightlifting, that seems to be working better for me. So that's working. I can tell you that just walking on a treadmill, eating low fat, the way a lot of people diet, I can tell you that has not worked. Was my gynecologist helpful? Absolutely not. I had one that when I was 18 and very vulnerable about my image, who told me that I might not be so hairy if I lost some weight. And at the time I had not embraced my hair, so it was a really traumatizing thing to say. I had another gynecologist when I was a little older, and I had a really, really troublesome period that was lasting for like 3 months. And she kind of brushed me off with like, well, obviously it's not very heavy, otherwise you'd be dead. So I haven't had very good luck with gynecologists. I haven't seen one in a while, probably for that reason. So you were saying you were bullied about your weight, anxiety, and hair. Have you been bullied due to your illness? Again, even though I didn't have the diagnoses, I can tell you I've been bullied for all of those things, obviously, as a teenager. Even though I tried to shave as much as I could, kids see stubble, and they're really freaking cruel. So yeah, I got called a werewolf and hairy. Growing up, I was always teased about my weight. I was teased for being poor. I was teased for looking different because, when I was 15, I was dyeing my hair blue and piercing my face, and at 32, I'm dyeing my hair blue and piercing my face. So, and now, of course, having the beard, I get really cruel statements made to me, at me, about me, both in person, on the street, and especially online, where a lot of people can pretend to be brave. How does that impact you? I'm going to be honest, a lot of people talk about how confident I am and how brave I am because I walk around looking like this. Sometimes sounds backhanded, but but the truth is, I struggle with it a lot. It's really hard, especially when people make comments that border on like death threats. It's really hard for me not to let it get to me. It's really easy to say these platitudes, forget the haters, ignore them, hurt people, like all these things are true, but when they're directed at you, it's really hard to not let it get you down. And as someone who has anxiety, and as someone who is struggling with depression, and has a lifetime of eating disorders that I'm working against, these words hurt, these words affect me. So I'm trying. The best way to put it is I'm trying. I'm working very hard. I'm trying. 10. So 10 and 11 both address fertility. I will come out and admit that I am really the last person anyone should talk to about fertility. I am seemingly am one of the few people with PCOS that really is not bothered by the fertility issue, because I don't want to give birth. Considering maybe years from now when I'm a little more financially stable, maybe adopting children, but I don't really have any desire to give birth. So I don't know how bad my fertility issues are because they've never come up in relationships I've been in. Though I wish you nothing but the best in your quest to conceive. Was there anything you'd like to discuss that I did not go over? So a point of view that I've brought up before that I have to be careful because it can sound smug, but I've broached before that a lot of people have the nomenclature about PCOS is very much fighting, overcoming, battling, suffering. There's a lot of approaching to PCOS that it's some sort of monster, and I have to be careful because for some people it is. For some people, especially, it's not just an emotional thing. People who suffer physically, I don't want to undermine that. But I do want to make it known that there are people who, look, even with me trying to lose weight, I still don't see my PCOS as my enemy. I still don't see it as something I battle against. Even on my hardest days, this is a gift. I'm using this to raise visibility, to raise awareness. I can't see it as a bad thing.